Hello friends, welcome to the part 2 of Q&A series. It's such an overwhelming response that we are getting from you in our comment box, and we love that you are liking our videos and the effort that we are putting to educate you, inform you about Bell's palsy and synkinesis. And to keep your support alive, I recommend you and I request you, please subscribe to our YouTube channel and also join our Facebook community so that we get more encouragement to come up with more good content for you guys. On that note, let's move on to today's video, which is the part 2 of Q&A series, where I'm going to read out loud the questions that you have asked in the comment box. Let's get started. Right, so this question is from Mr. Mahakal. And he's telling, ma'am, my right hand side is paralyzed, so I don't know how to do exercise. Please tell me. Well, this is a very common problem, especially when you have got facial paralysis along with stroke, which impacts your hand movements. In this scenario, I would highly recommend you should try to use your good side of the hand and just use practices where your hand act as a supportive agent and rest of the movements you do by yourself. This is absolutely possible if you get a little bit of training from a rehab professional who understands the techniques well. They will be in the position to guide you better in terms of doing these exercises. I hope this helps. If you have any further doubts, feel free to reach out to us. Alright, so let's move on to the next question, which is from Big Buddha. And he is asking, just developed this 2 days ago. This is the most frustrating thing I have gone through, but I hope for a quick recovery. Absolutely. We also wish you all the best for your fast and quick and complete recovery. Be patient, be calm, and allow your natural healing time to complete. Don't force your facial muscles to initiate movements. As your nerve will heal, your movements will also come back. Just trust the process and be calm. I hope that you recover soon. Right, the next question is about the smile muscle not working post Bell's palsy. This question is from someone named user IM2EY, but okay, I don't know the name, but let me read out the question. Hi, this is my problem of smiling. How long it takes for my smile to get back to normal with medication? Any other recommendation? Well, smiling returning back is not dependent on your medication. Your medication basically heals the facial nerve that has been inflamed, which has led to Bell's palsy. What can help your smile to retrain is your practices, your retraining. But this is something that should be done under supervision and under evaluation if you have recently developed Bell's palsy. Don't try to force contract your muscle. You can follow the practice of supported smiling, where your hand basically supports smile, and when you do this practice, you basically imagine or visualize that you are actually doing it, but refrain from physically doing it, because that will help your brain to get activated and to send right signals to your facial muscles. I hope this helps. Let's move on to the next question. Right, this question is from Miss Nana. She's telling, hi ma'am, my mom is currently 49-year-old and had been diagnosed with left side facial paralysis 2 months ago and has currently recovered by almost 90%. She currently uses pregabalin and certain tablets every day. Would you suggest continuing with the medication or stop them? Thank you, Nana, for your question, but unfortunately, I am not the right person to give you any suggestion on your medication. Your neurologist or the doctor who is treating your mother for her Bell's palsy, please take their advice. Please follow the advice as they are giving. Don't ever change your medication pattern without your doctor's recommendation. That is something that I would highly recommend to you. Next question is from Afroza, and she's telling, hello ma'am, I'm from Dhaka. 3 years ago, after surgery for a left-sided brain tumor, I developed Bell's palsy. Please suggest treatment. Hi, thank you so much for your question. Post-surgical Bell's palsy is a very common problem, and retraining is the answer to your question. You need to retrain your facial muscles, and the reason I deliberately use word retrain over exercise is because exercises done for facial paralysis is to retrain or reteach your facial muscles to move again the same way they used to move before. Not like exercise where you are trying to strengthen or build a bulk of a muscle. That's a very different thing. You need to focus on retrain. Make sure you do active assisted exercises if you have got some movements, but if you don't have any movements, then you should definitely do supported facial movements and take a guided help so that you can do your practice as well. I hope this helps. Right, let's move on to the next one. And this question is from Eklovely. And the question is, I am 9 months old from Bell's palsy. I haven't fully recovered yet, but I am starting to develop synkinesis. The exercise you mentioned, can I do them? If there are exercises for activation, they should be done with a lot of caution. We need to identify which all muscles are overactive for you, which all muscles are underactive for you in your synkinesis scenario. Then only it is a right way to do your facial exercises when you have synkinesis. So make sure that you take help of an expert or else a facial rehab professional who understands synkinesis well before starting any practices. Having said that, the videos that I post on the channel, they are of mild nature. They are not aggressive, so they are safe. You can definitely do it. On that note, these were the questions for the last week's video comments. If you have more questions, feel free to put it in the comment box below on this video. And you can also join our Facebook community where we conduct lots and lots of activities which will help you to educate yourself and inform yourself for Bell's palsy and synkinesis. So what are you waiting for? Go ahead and join the community. And don't forget to subscribe to this channel. I'll see you in another video. Thank you.